if I do a head to toe assessment on you?
No, I don't mind.
All right, and we do these just for like an annual checkup to make sure you're in good health.
Okay.
I would go ahead and wash my hands and then provide some privacy. Okay. Melissa, have you gone to the bathroom?
No, I have not.
Okay, I'm gonna go ahead and have you use the restroom before we start.
Okay.
So I'm watching her gait, making sure that she's not limping, not walking slowly or dragging like she could have Parkinson's, and she looks to have a normal gait. All right, I'm gonna go ahead and take your vitals.
Okay.
I would take her blood pressure. Normal would be about 120 over 70. Hypertension would be 140 over 90. Normal pulse is 60 to 100. Normal O2 is 94 to 100, and normal temperature would be 97 to 100.4, depending on the facility. And okay, I'm gonna go ahead and get started. I'm gonna go ahead and put my gloves on. I'm going to go ahead and take a look at your wristband. Okay, name, date of birth.
Melissa Holland, 6/15/89.
And do you know where you're at?
I do. I'm at MSSU.
Okay, so I'm going to take a look at her hair, make sure that there's no bumps, nits, lesions. I'm going to kind of feel around. Do you feel any pain anywhere?
No.
Okay. I'm also going to look at her ears and make sure that it's level with her eye. It could be a sign of Down syndrome if they were a little bit lower. I'm also gonna take a look at your ear here. I pull the canthus up and back, making sure that we have no drainage, discharge, no excessive buildup of earwax. And then I'm gonna look behind this ear, make sure that there's no tophi or skin breakdown, especially with us wearing masks nowadays. Make sure there's no crust, yeast, any of that good stuff. I'm gonna take a look on the other side. Again, up and back. Okay. I could also do an internal exam and look at her eardrum to make sure that was a opaque white and not bulging or red. Okay, she just has minimal earwax in there. Okay, next I'm gonna look at her face, make sure that's symmetrical. Can you smile for me? All right. I'm gonna feel your sinuses. Let me know if you feel any pain. Okay, I'm gonna look at your nose, make sure it's midline. Okay, go ahead and breathe. I'm just making sure that she has patency and that isn't congested one side or the other. I'm also gonna take a look inside of your nose. Make sure that there's no furnicles or redness or deviation of the septum. Okay, I'm gonna go ahead and take a look at your eyes, and I'm gonna go ahead and pull this down. Check the conjunctiva, make sure it's pink and not red or white or swollen. Okay, I'm gonna have you look straight ahead for me. Actually, hold on. Okay, go ahead and look at this. Look straight ahead. Look straight ahead for me. Okay, I'm just making sure that her pupils are dilating. Okay, now I'm gonna also have you look straight ahead still. Check in. Make sure that they are both constricting on each side. Okay. Now follow the pin for me. Okay. I do notice that she has a lazy eye. Were you born with that, or how long have you had that
Yes,
for?
I've had that since I was a child.
Okay, so that's probably normal for her. And again, we checked the 6 cardinal fields of movement to test for that oculomotor nerve, and it seems to be intact. Okay, next I'm going to look in your mouth.
Okay.
I'm just making sure that we have no dental caries in there. Let me go ahead and get my tongue blade out. Okay, go ahead and say ah. I'm just looking for a rise and fall in there to make sure that her gag reflex is intact. I'm also going to check underneath your tongue and the buccal area. Okay. making sure that there's no plaques or leukoplakia. Okay, next I'm gonna take a look at your lymph nodes. So I'm just gonna feel starting behind the ears. You're gonna feel her trachea, make sure that's midline. Okay, go ahead and swallow for me. I'm just feeling to make sure that she doesn't have an enlarged thyroid gland. I do not feel anything. All right, next I'm gonna feel your chest for some subcutaneous emphysema. And I don't feel any crackles or anything. I'm also gonna inspect her chest, make sure that she has equal rise and fall of her breaths, make sure that she has no burial chesting and that is equal anterior and lateral circumference. Okay, now I'm going to listen to your lungs. Go ahead, breathe in. I'm going to take a look around her back, so if you could just scoot your left a little bit for me. Alright, I'm looking at her posture, making sure that she has no lordosis or kyphosis, and to make sure that there's no deviation of the spine, so go ahead and lean forward for me. I'm going to check your spine alignment, make sure that there's no curvature to the sides indicating scoliosis. Okay, you can sit back up for me. I'm going to go ahead and palpate for kidney stones, so let me know if you feel any pain. Okay, I'm going to go ahead and listen to your lungs on the back side now. Okay, go ahead and lift your arms up for me. Okay, our breath sounds are clear. I hear no crackles or wheezing or others, and equal breaths on both sides. Okay, go ahead and lay down for me, Melissa. Give me 1 second. I'm going to go ahead and listen to your abdomen. First, I would look at it to make sure that it is flat, concave, or protruding. Hers is flat. Okay, now I'm going to listen to your bowel sounds in all 4 quadrants. Starting in the right lower quadrant, working my way up. Listening for bowel sounds about every 5 to 20 seconds at least, 5 to 20 times in a minute as well. If I didn't hear them, I would listen to 5 minutes in each quadrant. I'd say they're about hypoactive. I didn't hear a whole lot. I did hear a few bowel sounds in each quadrant. Okay, next I'm going to start palpating, starting with light palpation. Just let me know if you feel any pain. Feeling for tenderness, lumps, bruises. Does that hurt? Okay. Also for rebound tenderness. Now I can deeply palpate as an RN. Making sure not to palpate if she does feel tenderness deeply. Okay. Now I'm going to take a listen to your heart. Start at the aortic. Listening for a lub dub. Making sure that there's no extra heartbeats. Okay. I'm going to check her pulses. I can start with her apical pulse and listen to 1 full minute. Okay. I'm also going to set you up just a little bit to go ahead and look at her jugular for jugular venous distension. Also for pulsations, which could be normal if they're skinny. I'm also going to take a listen, make sure I hear no bruise. Okay. I'm going to go down and compare her brachial pulses. Then her radial pulses I can compare. Normal will be about a 2 or a 3 plus. Making sure that they're equal in rate and rhythm. Okay, next I can feel your femoral pulses. Her popliteal pulses. Go ahead and relax. Okay. Her posterior tibialis pulses. While I'm down here, I'm also going to be checking for swelling and pretibial edema. I'm going to feel her dorsalis pedis pulse. And while I'm down here, I'm going to check for your strength. So go ahead and push up. Okay. Now I'm going to have you push. Just making sure that she's equal in strength. Good. Now I'm going to go up here and test her hand strength. Okay. Go ahead and squeeze. All right, now I'm going to check for cap refill and also the health of her nails. Make sure that there's no pitting or striae. Make sure that there's no yellow, which could indicate fungal infections. Now I'm going to check her skin turgor for hydration. No tinting. I'd say she's mildly dehydrated because it's not fully bouncing back immediately. I can also check that up here on her clavicle. Okay, she's mildly dehydrated. I'd rate her pulses at a 2 plus. Okay. After that, I would go ahead and do a breast exam. She can lay down or sit up for this, whatever is comfortable for her. So I would feel the nipple first. I'd squeeze it, make sure that there's no discharge. If there was, I'd ask her if she's had a baby recently. If not, then that's a huge indicator for breast cancer. Looking at the symmetry, making sure that one's not drastically hanging lower than the other, making sure that one's not swollen. Feeling for heat while I'm palpating, And I would start inwards and walk my way around, also using circular motion, feeling for lumps or enlarged lymph nodes. And then I'd also feel up here in her axilla for lymph nodes, and the upper outer quadrants. Feel the axilla as well. Okay, and then I would teach her, make sure you're doing this in the shower about 7 days after your menstrual cycle, because that's when your breasts are the most relaxed and not affected by hormones. They're usually tender around your period. And then I could go ahead and do a genital exam with her laying like this, with her legs up or spread apart. I would check for bruising, any signs of abuse, which would be maybe bruises on the inner thigh in different stages of healing. I would check for discharge, whether it be yellow, green, or white and curdly like, which could be yeast infection. I would check to see if there was an odor. I would ask her about any burning with urination. I would also ask her questions about her sex life, asking if she's using protection. And after that, I would lay her in a left lateral side with her right leg laying over to check her rectal area. I would make sure that there was no signs of infection, skin breakdown, which is very common, ingrown hairs that you can find. Ask her when her last bowel movement was, and then I would conclude the interview and also see how she reacts throughout the interview emotionally. And Melissa, do you have any questions or other health concerns for me?
I do not.
Okay, you're good to go. I will get you stuff to clean yourself up with, and then let her get dressed, and then go document, and that concludes it. Okay, I'm going to go back in and explain what I would do if she was a male for the genital urinary exam. I would check the testicles, feeling in a circular motion, get every area of it, making sure I feel no pea-sized nodules. I would check the urinary meatus for bumps, lesions, cankers, which could tell me if they have syphilis, make sure there's no discharge, like gonorrhea or syphilis. Also, I would check to make sure that if he's uncircumcised, I would pull it back, make sure it's clean, make sure there's no buildup or yellow crust on it. I would check the shaft of the penis, also noting any lesions. I would check the male. I could do a prostate exam if the facility I was at did them. I would insert 2 fingers in, feeling for a walnut-sized prostate gland. I would also make sure that the urethral opening was in the correct spot and it wasn't too high or too low, no epispadias. And then I would teach him to do it once a month in the shower afterwards, and that concludes it.